It's about attention to detail. It's about offering patients individual plans that suit them and that are relevant to them. So I think it's really important for patients choosing a clinic to think about all aspects of their care, whether that's the clinical side of it, the preparation phase, right through to embryology, results, and transferring an embryo. But obviously, how you do IVF is really important too.
So we've both been doing this a really long time, and I think we both have very definite ways that we like to work and things that we know are important to providing patients with really good patient care and therefore optimum outcomes. I have deal breakers that I think in embryology, I always talk to my team about negotiables and non-negotiables. And I have a lot of non-negotiables. I think that gives you the best patient care. I'd really like to hear what your deal breakers are. What would you say to patients they absolutely need to be asking if they're looking for a fertility clinic?
I think it's really important that when patients are looking at clinics, they do their homework and they actually find out a bit about the service that the clinic provides and how does it deliver that service. I've now worked in several clinics. I think clinics will operate in different ways. There are over 30 clinics in London, close to sort of 100 clinics across the UK. So it's really, really tough for patients. For me personally, having worked in lots of different environments, it's about attention to detail. It's about offering patients individual plans that suit them and that are relevant to them. So if I have a patient coming to see me who's had 7 cycles of IVF and it hasn't worked, I'm going to be treating them perhaps with a completely different approach to someone who's coming for the first time who's never had any medication. So you've got to be able to adapt what you're doing with the patient. And some clinics will not have that ability because they'll be using certain types of drug medication perhaps with patients. And some clinics are very good and do very much like the Evewell, individualised plans for each patient that comes through the door. We offer a service 7 days a week, which means that we collect eggs 7 days a week. We can transfer embryos 7 days a week. Not all clinics will do that. The other thing that I'm really proud of what we deliver at the Evewell is that when you meet your lead consultant, actually, they will have overriding responsibility for your care. But we work as a team of 4 or 5 consultants who meet regularly, every day in fact, to look at every single patient's result, whether it's a scan, a blood test, changes in their hormones, changes in their symptoms, to make collaborative decisions about the best way forward for that patient, which means that there's quite a lot of dialogue through our amazing nursing team, because I can't phone every single patient myself, nor can my colleagues, because I'm seeing all of the patients. But it's having that connection with your doctor. We also try to make sure that you're paired with your doctor as much as possible going through. Now, that isn't always achievable, but certainly what we are trying to aim to do is to actually have the patient from the start of their cycle through to their egg collection, through to their embryo transfer, and also hopefully a pregnancy scan with your main lead consultant, which is quite unique and is not achieved in all clinics.
So it's interesting because some of the deal breakers that you have also mirror into what I believe to be absolutely solid about what is right for patients' care. The 7-day service, it mirrors into the lab. You cannot have embryos growing every day. They don't know it's the weekend. They don't know it's a bank holiday. They are needing to be looked after on constant monitoring. So we have people on call and people available to work 7 days a week. We have a rota system so that everyone gets the rest they need. It's really important to the embryology team. But equally, in our support of your patient's journey, I think you'll admit that I think it's really important that we're very heavily involved in the patient communication, and we will see at the Evewell an embryologist consultation will happen for every single one of your new patients that you will see. And I think that it's true to say that you find quite a lot of value from that as a doctor.
Oh, hugely. And I've worked with wonderful embryology teams over the years, but the way, I think that is a uniqueness about what we do here. And as I say to each patient at their egg collection, the lab team will now take over all the communications because you're the scientist, you're the expert. And we've got actually some wonderful communicators in our embryology team there. We don't just want to lock our embryologists away in the lab in the doing all the science. Actually, they are huge in our success of what we are able to achieve at Evewell. So I think we want them front and centre, talking to our patients, having that dialogue. And actually, patients sometimes coming from other clinics are quite surprised when they hear that happens here. But I think it's really, really important because you're an expert in embryology. I'm an expert in how we do fertility treatment, surgery, reproductive medicine. So we have to recognise everyone's skill set. And I think it's that amalgamation of talent that brings out the best results. So
actually, going back to the 7-day service as well, from my perspective, having also worked in a number of clinics, the amount of mature eggs I get from any patient and the amount of blastocysts that I'm able to achieve is absolutely much higher, because we are able to time that egg collection almost to the minute, rather than it being a set number of days that we're trying to collect eggs on. And you definitely see better outcomes in the laboratory from being able to trigger and egg collect patients on any day of the week, rather than being defined by a process that is led by other constricting factors. So I think that's really important, that approach to a 7-day service isn't just for you or for me, it's actually for the health and the benefit of those eggs coming from that patient at the Evewell.
And you said at the start there, you have a few sort of red lines and things that are non-negotiable. What are those in the laboratory?
I also believe really strongly in embryos being utilised no matter what they look like. Embryo grading is a huge buzzword in our field. It's completely misunderstood. It is missold. It's misinterpreted, because it is incredibly nuanced. Embryos that can be good grade, poor grade, average grade, I think ultimately they are the patient's embryos. And it is our job to help the patients understand the potential of those embryos and utilise those embryos. So one of my non-negotiables is I do not make decisions for patients about which embryos we will and won't freeze, which embryos we will and won't biopsy. We will talk to the patient about what we're seeing, from our experience, what that visually means for that potential for that embryo, and we'll help a patient make a decision about what is best for their context, their journey, in regards to freezing and utilising all types of embryos. We culture till day 7, which I think is really important. You definitely still see live births in day 7 embryos. So for me, that's also an absolute given that we would run a 7-day service and all embryos are cultured to day 7 if that's necessary.
And one of the things I remember when I first came to work here speaking to you was that, I remember the words really well, was we do our absolute best to give people a baby, but if we can't, we do absolutely everything we can to give them information that they understand what has been the challenges, where they are, and obviously it's such a difficult journey going through fertility treatment. I can't imagine some of the patients we have who've been through years of it. To actually have a clinic that can actually explain stuff to you, maybe we haven't achieved success, but we've given you information. And over the years, I've had, certainly in my time here, many patients who are very grateful just to understand finally why things have been a challenge. It also helps us narrow the lens when we're talking to you about what you're seeing and what we're seeing, to then try and work out where we can take patients to. So I think that really does help with trying to solve really, really complex IVF cases.
Yeah, absolutely. You cannot even understand what an embryo is doing unless you've got a camera on top of it, which is obviously comes from the time-lapse incubators that we use. Watching an embryo grow is so powerful to understanding its health. And like you said, a lot of patients, obviously they're coming for an outcome, but there are many patients that come to us several cycles deep, ultimately looking for answers. And if closure is that answer, then it's about helping them reach that with no point of regret, I suppose. So sometimes actually being able to watch these embryos and being able to help you with those conversations is incredibly important as well. So time-lapse for me is also one of my deal breakers, because I really do feel it does help patients understand what we can change if we need to change something. And also, if it doesn't work, why didn't it work?